Hello guys, so today we are going to talk about the pharmacokinetics and drug absorption and the routes of administration. So let's begin. Mm, Um, Not this one. One second, I'll just open the file. Okay. So what are the routes of drug administration? So we have various types of routes: oral, buccal, sublingual, rectal, intravenous, intra-arterial, intramuscular, intraossal, transdermal, subcutaneous, and by inhalation. Okay. So oral route of transmission is very convenient and it's cheaper and the risk for this is very low. Uh, okay, and the ingested drug have low bio availability. So what is this bioavailability? So bioavailability is basically the percentage or fraction of administered drug or dose that reaches the bloodstream. Okay, so how can I explain this? Like, see, so you took 100 milligrams of paracetamol. Okay, paracetamol. You took 100 milligrams of paracetamol. Okay, now if I say that that 70% of the drug is metabolized in the GIT. Okay, like the 100 milligrams of drug is given to you. Okay, and 70% of it is metabolized by the liver or by the GIT. Okay, so so tell me how much of the drug is in the blood. So 70% of 100 milligram is 70 milligram. Okay, so 70 milligram of paracetamol is metabolized. Okay, so so that means that only 30 milligrams of paracetamol is in the bloodstream. Okay, so that is called the bioavailability. And bioavailability basically it is monitored by various factors. Okay, so and this first pass effect. So what is this first pass effect? So it is basically the okay. So we have two types of routes. First is the parenteral route and the enteral route. Okay, so enteral route is basically the route in which the first pass effect is applied, and parental is a route in which the first pass effect is not is avoided. Okay, so what the freak is this first pass effect? So actually the drug when we give the drug via orally. Okay, orally. So that drug it passes from the GIT, from the mouth to pharynx to esophagus to stomach, and then to small intestine, and then eventually it gets absorbed. And when it gets absorbed, the portal when it it carries this metabolized drug to the liver, where the drug get again metabolized. Okay, so the bioavailability is basically the of the drug which is given orally is very low. Okay, because it is metabolized in the stomach, in the small intestine, right? So yeah, and availability of the drug which is given intravenously is 100%, because we give drug directly into the veins, directly into the bloodstream. Okay, so okay. So intravenous type of route of administration. The intravenous route offers instantaneous and complete absorption. Bioavailability is 100%. This route is potentially more dangerous. Why this route is dangerous? So actually the drug that we should give via the intravenous route of administration. should not be apyretic, sorry, aseptic. Okay, it should be aseptic. It should be antipyretic, and it should be isotonic to the plasma. Okay, so okay, yeah. Intramuscular route of administration. So, intramuscular absorption from an intramuscular injection site is often faster and more complete, higher bioavailability than with the oral administration. Large volumes, example, more than 5 ml into each buttock may be given if the drug is not too irritating. First pass metabolism is avoided, but anticoagulants like heparin cannot be given by this route because they may cause hematomas in the muscle. Hematoma means so the subcutaneous route offers slower absorption than the intramuscular route. Larger volumes of bolus doses are less feasible, but heparin does not cause hematomas when administered by this route, and first pass metabolism is also avoided by this route that is called subcutaneous. Okay, so hematoma is basically the coagulation of the things. So yeah, and subcutaneous route so the needle is given at an angle of 45 degrees. Okay, 45. So buccal and sublingual, the sublingual route under the tongue permits direct absorption into the systemic venous circulation, bypassing the first pass metabolism and hepatic portal circuit. This process may be fast or slow depending on the physical formulation of the product. The buccal root in the pouch between the gums and cheek offer the same feature as the sublingual root. Okay. So now this is very important. So do not give the drug which contain proteases like Festal, Panzinum, Creon, Mazin Forte, because when we chew this kind of these kind of drugs, so these enzymes make it activated, and they may cause the damage to the mucosal membrane of the mouth. Okay. Now, how do they get activated via the alkaline pH of the mouth? Okay. So don't give drugs that have enzymes in it. Okay. Now, rectal suppository. The rectal route offers partial avoidance of the first pass effect because suppositories tend to migrate upward in the rectum, and part of the administered dose enters the portal circulation. Larger amounts of drug with unpleasant taste are better administered rectally than by the sublingual or buccal routes. Rectal administration is often used in patients who are vomiting or if the patient is unconscious. Furthermore, this route is often used in pediatrics. Some drugs irritate the rectal mucosa. Inhalation. In the case of the respiratory diseases, for example, asthma or chronic obstructive pulmonary disease, the inhalation route offers delivery closest to the target tissue. This route often results in rapid absorption because of large and thin alveolar surface area. Examples of drugs administered via this route include bronchodilators like albuterol and corticosteroids like fluticasone, topical. So this route includes application to the skin or to the mucous membrane of the eye, ear, nose, throat, airway, or vagina for local effect. The rate of absorption varies with the area of application and the drug formulation, but is usually slower than any of the routes listed previously. So, if they ask in the exam that which is the slowest method of a route of administration, so you should write the topical, and this route is used for the local effect. Okay. For example, clotrimazole is applied as a cream directly to the skin in the treatment of a dermatophytosis. Okay. When we apply this type of topical route, so we should take care that the patient's age. Okay, so patient age is very important. In children, we cannot give the topical route of administration, because their skin is very hydrophilic. Okay, so the drug might get into the systemic circulation and cause toxicity in the blood. So the topical route of administration is avoided in the case of children. Okay. Intravitreal injection is given in case of diabetes mellitus, in case of retinopathy, adenoma, and we give the intravitreal injection in case of so transdermal. This route involves application to the skin for systemic effect, usually via a transdermal pouch. Absorption usually occurs very slowly, but the first pass effect is avoided. This route is often used for the sustained delivery of drugs like durogesic, fentanyl, narcotic analgesic in occupations, anti-anginal drug nitroglycerin, and anti-mimetic scopolamine and nicotine transdermal patches, which are used for to facilitate smoking cessation. Okay, guys. So we have finished the rules of administration. So next, hello, Ketan. Hello. Hi. So now we are going to talk about the what is- huh, absorption of the drug. Okay. So, basic pharmacokinetic processes: drug absorption, distribution, biotransformation, elimination, and the factors affecting them. So, pharmacokinetics, the action of the body on the drug, including absorption, distribution, biotransformation, and elimination. Okay. So, stop for a moment and ask yourself that why are you learning the pharmacokinetics? Okay. It is basically the effect of body on drug. Okay, so like how the drug passes through the body, like from how many compartment does this drug go. Okay, so and this is important for to to plan the dose of the drug and give it for the therapeutic effect. Okay, so human body can be viewed as a complex labyrinth of fluid-filled cavities where hematogenous barriers, blood-brain barrier, hematotesticular, hematoplacental, and hematothyroid, hematocochlear additionally function. The ability to overcome these barriers can only be achieved by lipophilic compounds and low molecular weight hydrophilic substances. Lipophilic compounds and low molecular weight hydrophilic substances. It should be emphasized that lipid soluble substances are more easily absorbed since they easily penetrate by diffusion into the phospholipid bilayer cell membrane. Mathematical pharmacokinetic models. So, mathematical pharmacokinetic models are developed to describe the movement of a drug in the body. In these models, the body may be represented by various compartments, that is, groups of tissues with similar blood flow and drug affinity. For some drugs, only one compartment matters: the circulatory system, because they stay in blood and do not move into the other tissues. Okay. So for some drugs, they only stay in blood. Okay, and there are some drug okay, for example, we will take the anesthetics. Okay, so anesthetics we give. Okay, for example, we give an anesthetic to the patient via the intravenous administration of root. Okay, So anesthetic should go from the blood to the brain. It should cross the blood-brain barrier. That is one type of barrier, and it should reach the brain, and then it should work there. Like therapeutic effect should be done by the drug. Okay. So for this drug, first compartment is the blood. Okay. Then second compartment is the blood-brain barrier, and then third compartment is the blood. So for other drugs, two or three compartment model is more appropriate. Compartmental models are used to visualize and represent where a drug moves as it travels throughout the body. So absorption of drugs. So what is the so it is basically the transfer of drug from the route of administration to the bloodstream. Okay. So to produce useful therapeutic effect, most drugs must be absorbed, distributed, and eliminated. Absorption is the transfer of a drug from its site of administration to the bloodstream. Most drugs are administered at a site distant from their target tissue. To reach the target, they must permeate through both lipid and aqueous pathways. Okay. Okay. So, um, movement of drugs to membrane occurs by means of aqueous diffusion, water, glucose, lipid diffusion for general inhaled anesthetics, transferred by special carriers, and transferred by exo and endocytosis by active transport. Example is vitamin B12. Vitamin B12. So routes of absorption depends on route of administration, blood flow in the tissues, concentration of a drug, food. For example, fatty food dramatically increase the bioavailability of the antihelminthic albendazole, while dairy products impair the absorption of doxycycline because doxycycline is a complex with calcium ions. Okay. So don't give doxycycline with the dairy products. Doxycycline will be complex with the calcium ions. Okay. pH of drug and environment. So physicochemical properties of active substances. Molecules need lipophilicity and hydrophilicity, chemical nature, degree of ionization in alkaline and acidic environment, concentration, etc. P glycoprotein. P glycoprotein is a transmembrane transport protein that removes medicinal substances from the cell body. Its synthesis occurs intensely in the small intestine, liver, kidneys, blood-brain barrier, placenta, testicles, and tumor cells. Expression of P-glycoprotein gene MDR1 significantly reduces the absorption of the drug from the small intestine and affects bioavailability. So let's summarize P-glycoprotein. It is a transmembrane transport protein that removes the medicinal substances from the body. Medicine. Other medications cannot be prescribed in combination with activated charcoal, since charcoal effectively absorbs drugs due to a large quantity area, and the pharmacological effect is significantly weakened. Tissue mining. So, with parenteral administration of drugs, the substances are absorbed, the process of which depends on their physicochemical properties (pH), the intensity of the hemodynamics and in the tissues, and the degree of binding of the substance to tissue structures. For example, local anesthetic lidocaine use vasoconstrictors to prolong the pharmacological effect, which constrict blood vessel and prevent drug from entering the bloodstream, leaving the injection site. Okay. So accordingly, the duration of local anesthesia doubled on average. The lipophilic substance diazepam, while injected intramuscularly, binds so directly to muscle tissue the therapeutic concentration in the blood is observed only a few hours later. This is why diazepam is administered intravenously or rectally as a micro environment during epileptic seizures. Even inhalation. Okay. So diazepam is a drug uh, uh, which is to be given by intravenously, and lidocaine is also given intravenously. Many drugs are weak bases or weak acids. Weak basic drug will be more lipid soluble at alkaline pH of environment. Okay. Weak organic acid drug will be more lipid soluble. Okay. Base will be uh, base will be um uh, okay. So, weak basic drug will be more lipid soluble at alkaline pH, or organic acid will be more lipid soluble at acidic pH. This is the rule of absorption. Example: cocaine is a basic drug, absorption of which rate of absorption depends on concentration of drug dose and how. So, aqueous diffusion and lipid diffusion are predicted by fixed law and are directly proportional to the concentration gradient. The more the more diffusion is always passive process and doesn't require energy supply. Okay. So, how fast is absorption and what factor does it depend on? Drug absorption is faster from organs with large surfaces like small intestine than from organs with smaller absorbing areas the stomach. Furthermore, drug absorption is faster from organs within membrane barriers, example in the lung, than from those with thick barrier, example in the skin. Drug distribution. After absorption, drugs are distributed to different parts of the body. Drug distribution is the process by which drug reversibly leaves the bloodstream and enters the interstitium, extracellular fluid, and then to the cells and to the cells of the tissues. Distribution may be restricted to the extracellular space, plasma volume plus the interstitial space, or may also extend into the intercellular space. Some drug may bind strongly to tissue structures so that the plasma concentration falls significantly even before elimination has begun. In this case, drug concentration is high. Having a note, having entered the blood, drugs may bind to protein molecules, albumin produced by the liver that are present in abundance, resulting in the formation of drug protein complexes. Protein binding is of great importance because it is a concentration of free unbound drug that cause a pharmacologically relevant effect, because only free drug will move out of the bloodstream, reach target sites, enter hepatic sites of metabolism, or undergo glomerular filtration. Only unbound forms of a drug move out of the bloodstream and reach target sites in the tissue to cause a pharmacologically relevant effect. If for various reasons the free fraction in the blood increases, the toxicity of drug also increases. The degree of binding to plasma protein is influenced by pathologies of the liver and kidney, dysproteinemia, limited dystrophy, medications, pregnancy, etc. It should be emphasized that with the oral administration of the drug, as well as from the with the intramuscular or subcutaneous adhesion. Okay. See. Distribution and absorption are important, determined by rate and extent to it. Okay. Okay, guys. So that was it for the today, and I'll be back in I guess 7. I will be back at 7 in with the pathology. So yeah, thank you, thank you, Ketan. Bye.